At the Reproductive Health Center, we strive to have a non-threatening, non-clinical environment. You'll notice in our waiting room that we have comfy leather chairs. It's set up like a living room. We try not to have people have to wait in here for too long, but we do make it very comfortable. As you proceed down the hall, you'll notice our front office where Joan and Joanna work diligently to make appointments and to keep people on schedule, and also to keep Dr. Hutchison on schedule. And you'll notice after you've passed that area that we have a very comfortable conference room. Further down the hall we have 3 exam rooms, each of them with a different color. They're a little bit more clinical looking. We have ultrasound machines in here that we utilize. And then in the center we have a nurse's station. And the nurse's station is where we also do our blood draws. It's got a really nice window in it. It's not very clinical. As you proceed down the hall, on one side gives you access into our IVF suite where we do the actual IVF procedures. You'll notice in this room that there is a full anesthesia monitoring equipment, and this is equipment that if anyone were to remotely have a problem, an anesthesiologist could resuscitate them at any moment. Through the IVF retrieval room is the recovery suite, and this room is we try to keep it very pleasant, and it has its own bathroom en suite. Off of the IVF retrieval room is the actual high-tech embryology laboratory. This room has all the equipment that the embryologists need and use to create the embryos in. So the eggs once the eggs are retrieved, they go immediately into this room and immediately into culture and incubators that keep them at body temperature and also in the dark. They're given all the nutritional supplements they need, everything that they need to mimic life inside the body. This room is a very, very special room and has extremely limited access only to the embryology personnel. At the end of our hallway, we have the Wall of Fame, which is our baby board, which we really enjoy seeing. And there's offices back here for both embryology and my office, which is kind of a catch-all office sometimes. And then at the very end of the hall is the andrology lab and the hormone assay laboratory. And that's pretty much the lair of the embryologists and also of Pamela, who's our medical assistant. And she performs the semen analyses along with Dr. Hernandez and Teresa, and then also does the blood testing for us.